Please watch the entire operating instructions video prior to testing. This test is for non-prescription home use by individuals aged 14 years or older testing themselves, or adults testing individuals aged 6 months or older. The Flowflex Plus RSV plus Flu AB plus COVID home test is a visually read lateral flow immunoassay device intended for the rapid, simultaneous qualitative detection and differentiation of respiratory syncytial virus, RSV, Influenza A, Influenza B, and SARS-CoV-2 protein antigens directly in anterior nasal swab samples from individuals with signs and symptoms of respiratory tract infection. Please read the quick reference instructions before performing the test. Wash or sanitize your hands. Make sure they are dry before starting the test. Carefully read the instructions before performing the test. Failure to follow the instructions may result in inaccurate test results. Remove the test cassette from the pouch and lay on a clean, flat surface. Locate the result window and sample well on the cassette. Remove the buffer tube from the pouch. Remove the foil from the tube. Punch through the perforation on the box to form a tube holder. Place the tube in the holder. Open the swab package at the stick end. Take out the swab. Do not use the swab guard. Do not touch the swab tip. Gently insert the tip of the swab into one nostril, 1/2 to 3/4 of an inch. Firmly rub the swab in a circular motion against the inside wall of the nostril 5 times. Take approximately 15 seconds to collect the specimen. Repeat this in the other nostril using the same swab. Remove the swab from the nostril and immediately place into the buffer tube. Swirl the swab in the buffer tube for 30 seconds. Rotate the swab 5 times while squeezing the tube. Incorrect results may be observed if the swab is not swirled for 30 seconds or rotated 5 times. Remove the swab while squeezing the tube. Note: the swab with the collected sample should be tested no more than 30 minutes after adding to the tube. Discard the swab. Attach the dropper tip and mix by swirling or flicking the bottom of the tube. Invert the buffer tube and gently squeeze 4 drops of the sample into the sample well. Discard the tube. Note: an invalid result may occur if less than 2 drops are added to the sample well. Set the timer and read the results after 15 minutes. Do not read after 30 minutes. Note: a false negative or false positive result may occur if the test result is read before 15 minutes or after 30 minutes. Individuals with impaired vision or color-impaired vision should seek help in interpretation of their test results. This test is read visually. Note: any visible faint or pink line in the test line regions R, A, B, CoV should be read as positive for that virus. If both control CTL lines are visible, but the test R, A, B, CoV line or lines are not visible, the test is negative. The RSV, Flu A, Flu B, or COVID-19 virus have not been detected. If respiratory symptoms persist, seek follow-up care with a healthcare provider. If the control CTL line is visible on both strips, and any line or multiple lines, no matter how faint, at R, A, B, and/or CoV appear, the test is positive for that virus. The RSV, Flu A, Flu B, and/or COVID-19 viruses were detected in your sample. It is very likely that you have the respective infection or infections and are contagious. Please contact your healthcare provider or your local health authorities and follow local guidelines for self-isolation. There is a small chance that this test can give you a positive result that is incorrect, a false positive. If the control CTL line is not visible on either or both test strips, even if any test line is visible in the result window, the test is invalid. Retest with a new test kit and sample. If the problem persists, call 800-838-9502 for assistance. Individuals should provide all results obtained with this product to their healthcare provider for public health reporting. Report your test result or results at makemytestcount.org. This voluntary and anonymous reporting helps public health teams understand RSV, influenza, and COVID-19 spread in your area and across the country, and informs public health decisions.